We are so grateful you've chosen to join us today for this discussion on mental health in the workplace. Our guest is someone who I greatly appreciate. Yinka Ajirotutu is with us. And in this session, we're going to be looking at tools employers can put in place to enhance the well-being of their employees when it comes to mental health. We're going to look at how to enhance your EAP and make it most valuable for your team. We're also going to take a look at how to enhance the culture, your workplace culture, to help the mental health of your employees. And we're also going to delve into how to help employees who are dealing with mental health issues with their own children. A lot of good things we're going to be talking about here, and so glad you're able to join us.
Imagine the possibilities if you had more choices available to prosper your employees' well-being and benefits and futures. You'd enjoy a culture of engaged employees, and the results would include a more productive workforce and newfound opportunities. TBC Events is your inside look at how companies just like yours experience positive shifts in culture and cost containment when they learn the choices and innovation available. The Benefit Company is pleased to have you join us.
Good morning, Yinka. I'm so glad we finally have this chance to meet in person. We've been corresponding, I think, via email and phone for maybe 2.5 years. I think we first met when one of our employer clients was looking for a speaker for a lunch and learn. They wanted someone to talk about mental health, stress, things of that nature. And I had reached out to several people I knew to find some recommendations. And one of those people was David Maffei, who was the head of HR at Emory Hospitals. And he had put me in touch with one of the people in the medical staff there. And she wasn't able to come, but she said, hey, my friend Yinka, I think she would be great, my colleague Yinka. And so there we started a conversation. And we thought, hey, yeah, let's have Yinka come to this employer. And after you visited with them, the feedback was phenomenal. People just appreciated what you had to say, how you related to their employees. So much so that we had another client asking for something similar not long after that, invited you back again. And once again, that feedback was phenomenal. So when we had this opportunity, you were the first person that came to my mind to have this conversation.
So what you may not know, Jack, is when I received that initial invite to assist and provide that mental health presentation, that actually was the first formal opportunity that I had received to actually speak about mental health and my experiences there.
Okay.
And it was such a passion of mine that I learned through that experience. It has jump-started so many other opportunities, including my business. So this is very fortuitous that we are now sitting down together, finally meeting, and also having the opportunity to do this podcast.
Well, that's great. And I tell you, one of the reasons why we wanted to have the podcast with you is we wanted to introduce you to some of our clients, some of our friends, so that they might be able to invite you in at some point and have this conversation with their employees. This conversation, Yinka, you and I have talked about. We talked about our purpose, and our purpose is to provide solutions and tools to employers who are looking for better ways to address the behavioral health of their employees, the mental health, and addressing some of the issues that they're facing. And by saying that, I want to say there's two things we're not going to do this morning. Number one is we are not going to talk about the why of mental health in the workplace. Most people who are listening in on this show, they already know the why. They know all the issues about productivity, absenteeism, presenteeism, all of those things that people want. We're not going to talk about those statistics this morning. We're going to assume that those that are listening in know there's an issue and they want to find solutions. The second thing we're not going to do is we're not going to be very clinical. We are not I'm not a psychiatrist, and we are not. Okay. And we are not going to be using the jargon that we would be using if we were talking to a group of medical professionals. We're talking to HR folks. We're talking to C-suite leaders. We're talking to frontline supervisors and managers. And we're talking about what we can do about mental health in the workplace. With that being said, you do have some great experience in education that helps you as you come to this point. I believe you were a graduate of University of Cal Davis. There you received a degree. Let me see, I have to look at my notes here, but a degree in psychology and African American studies, and then your education at St. Louis University with a master's in administrative or health administration and MBA. And then you've worked with hospitals in Chicago for 6 years, 4 years at Mayo. You were 6 years in DC working with government healthcare agencies, and then you came to Emory University where you still work as a consultant. So you have some credentials and experience that you bring to the table today. But your story is more than just a business and work. It's very personal to you too. Tell me a little bit about that.
Absolutely. So what's not shared within that bio is that for many of those years, I struggled with anxiety, persistent worry and overthinking. And when we're dealing with stress and we're dealing with the ups and downs of life and work, we often have coping strategies, right? Some of them are healthy, some of them not so much, but they help us in that moment, even though there may be long-term consequences. And so I found that worrying and overthinking was how I coped with the challenges that I faced at work. And over time, it seemed to work for me. However, everything came crashing down in 2019. I went in for a routine physical and received the news that I had developed an autoimmune condition, which is called hyperthyroidism or Graves' disease. And one of the causal factors of that particular disease is anxiety. And so one thing that I really want to share with our leaders and just with the public at large is that when we do have these mental health conditions, these mental health habits, they can affect us physically, emotionally. Obviously, they affect our family. So those habits that we are doing daily, it's so important that we're focusing on more healthier habits. And so when I received that news, literally it felt like someone pulled the rug out from under me. And I knew I had to make some very serious changes.
It was a big wake-up call, wasn't it?
Huge wake-up call. Some of those were practical, like you need to exercise more, stop pulling up to drive-thrus after a long day of work, stop sitting on the couch and not moving your body after a long day of work. But some of them were more mentally focused, which were setting boundaries for myself around how I viewed my work. And a big one was doing the very best that I could at work, but not allowing work to overtake my life with many things that I could not control. And so I share that with many leaders because I see quite a bit of what I went through reflected in many leaders. They feel so much responsibility. They feel the burnout. They feel the overwhelm. They're taking their work home. They're struggling to manage that mentally and physically. And it's so important that we give individuals positive habits for how they can deal with that from a mental health standpoint so that they can thrive, not just at work, but also at home as well.
Were you comfortable at that time sharing those struggles with your employer? And if you did, or did they, how did they respond?
I was pleasantly surprised. I have really had such a warm response to it. I think people want the authenticity, they want the vulnerability, and seeing someone that, you know, appears like, oh, they're fine, they're doing okay. And then having that very honest moment allows people to also be honest too and say, you know what, maybe I don't struggle with anxiety, but, you know, I feel depressed, I feel sad here and there, or I struggle with feeling overwhelmed at work and like I can't get it all done, and what does that say about me? And so one of the most awesome things that I think we can do with regards to opening ourselves up around this topic is it gives people permission to do the same.
Okay, and that's a perfect lead into what we want to talk about today. So let's begin with this question, or continue with this question. Can you share some proactive steps that employers can take to support the mental health of their employees?
Absolutely. So we are living in a very different environment now. I don't know if we can say post-COVID. I think we're still in it.
We want to, right? We want to say it, but every time we think we can, we get hit in the face again. But
exactly. But I will say this is a very different environment. We have employees who are much more discriminatory when it comes to where they will work, and they are seeking for their employers to provide a safe space and to have resources and support for mental health. And so one of the things I encourage employers to think about is joining that conversation, because employees are definitely talking about prioritizing their mental health to each other, to their families, and employers are often on the sidelines. And so I encourage the employers that I work with and those listening to join the conversation, and in many cases lead the conversation with your employees around how you can best support their mental health. And so those questions could look like, how is your mental health? How are you feeling? What is your stress level as it relates to work? What is stressing you out at work? Why is it stressing you out? And what can we do to help you? Because there is quite a bit that employers can do within their locus of control to help employees to have environments that actually support their mental health.
And it's asking those questions with the aim of wanting to help the employee.
Absolutely.
Sometimes those of us in HR or in leadership, it's a check the box type question that we may ask at an annual review or once a year, or how often we may have those conversations. But from what you were saying, you're saying have those conversations with the real intent of finding out how they are doing and how I, as the employer, can respond to help you as the individual.
Absolutely. And I do feel that when employers have those conversations consistently, they are going to start to see themes. They are going to see hot spots of where employees are struggling with regards to perhaps the culture, perhaps with the relationship with their leadership. There'll be different areas that they'll be able to see, okay, there are some opportunities here that we can work to improve for our employees at large.
When you and I were talking prior, you talked about the importance of authenticity when it comes to the leadership in an organization, of those leaders being authentic. Can you explain what that is in this setting when we're talking about mental health and how that plays out in an organization with employers' leadership being authentic?
Absolutely. So as we talk about, and I know we're probably tired of hearing this term, but I think it fits this new normal. I do think it's going to require leaders to be stretched a bit with regards to authenticity and vulnerability. Gone are the days where you have to appear like you have it all together and you are this stalwart soldier who comes to work every day and always has great days, right? I think our employees are really desiring and really wanting to see the humanity of their leaders, and having leaders say, hey, you know what? I'm struggling with anxiety. I'm struggling with being overwhelmed or burned out. And allowing employees to also share their struggles and providing that safe space for them to do so, I think is incredibly important. And even if you don't necessarily have a mental health story as a leader, there are still ways to connect, whether it be sharing a story about someone you love or a family member, or just relating to something that you've seen within current events or at large, to just say, hey, I know mental health is a major issue for many, and I want you to know that it's safe to come and speak to me. I want you to know that I'm available to have those conversations. And I really think we have to confront the elephants in the room, that this is not going to affect how I see you. This is not going to affect, how I see your ability to do the work, because that is the stigma that still is out there that many struggle with, that they fear that if they do share what they're struggling with mentally, that it will negatively impact their reputation or the relationships.
Right. And the truth is, 50% of us sometime during our lifetime, a minimum of 50%, are going to need some type of mental health assistance.
Yes.
That's just what the statistics show. We're all going through something. We're all somewhere on that continuum.
Absolutely.
And we're at different places now. And if we can share what we have gone through, what we're going through, it helps us to relate, and it helps others to find the help that they need and to be able to speak up. And that's part of the culture that we need to build. You talked about, you mentioned the word stigma, and I think stigma is huge in the workplace. Those negative thoughts that employees will have, that if they open up and if they're transparent, or what are other people thinking? And that stigma may be real, or it may be perceived. Just you're taking all your past experiences and you're saying, well, my employer has those same feelings.
Yes.
How can employers address stigma in the workplace when it comes to mental health in particular?
Right. So I think that, as mentioned, I think the authenticity and vulnerability is key. And I always recommend that, a senior leader, whether it be the CEO or the COO, be willing to be authentic and vulnerable to the organization's employees and really set the tone for the organization at large, that this is going to be a safe space to have these conversations. We are open and we want to know what's going on in your life. We embrace you as a whole person, not just a person that comes in and does work and that's all we need from you, and you go home and you do it again the next day. And I would say for those leaders that are on the front lines that are managing, the staff directly, is ensuring that when staff members do come to you, that you're a listening ear. I think well-meaning leaders will often, oh, it's not that bad, or, you can get through this. It's not something you need to worry about. And in doing so, almost negate that individual's experience and trying to, help them. And so I think it's important to listen more, encourage, support, have knowledge about the mental health and behavioral health resources the organization provides, and making sure that you continually check in with that individual to make sure, hey, so have you followed up perhaps with EAP, or have you followed up to complete what we've discussed? And then additionally, changing and or reassigning, reallocating responsibilities to ensure that employee is supported. So if employee is overwhelmed, that might be an opportunity to see, do we need to reallocate some work? Do we need to reassign priorities? Perhaps that employee may need a few days off or an afternoon off to just get away and decompress. And so really for leaders, there has to be an intuitive discussion as well around how can I best support this employee in this moment to make sure they feel supported and get what they need.
Okay, great. And I also think when it comes to stigma, those are proactive things we can do. I think there's things that we do inadvertently, whether we're leaders or whether we're the employees. And that's the language we use. The language we use can create that stigma or reinforce it. You think of sometimes how easily we'll use the word crazy or psycho or loony and things of that nature, not knowing that those words have a lot of meaning. Yes. I think of how we label some people. It's like, if someone is suffering from dealing with bipolar, we will refer to them as bipolar. or we refer to someone as schizophrenic as opposed to someone who is suffering from schizophrenia. And, if you have a broken leg, I don't say she's broken leg. If I have a kidney stone, you don't say I'm kidney stone. You say he has a kidney stone. He's suffering from a broken leg. He's healing. But when it comes to mental health, the language we use is so important because we label as opposed, we see mental health issues separately from physical issues, and just how we talk about those can reinforce a negative stigma. Do you see that in the workplace?
Absolutely. And I love what you said there because, when you make that, it's a small shift, right? But it's a huge differentiation in understanding that someone is experiencing something or suffering from something versus connecting it to their identity and who they are as a person. And so I think people often will do those things unthinking and not understanding the impact. And then for those that may be going through those issues in that moment, it can be very triggering and cause them to want to retreat more.
I think about how sometimes you see someone who's very detailed and we say, oh, they're OCD. Or we see someone who's thin and we say, oh, they're anorexic. And if you're dealing with those issues and you have those in your family, that's a very painful statement to hear. We just need to be careful. And it starts with the leadership. It starts with HR. It starts with that C-suite. It starts with those frontline managers. We learning how to address these topics.
Absolutely.
You had mentioned a moment ago the EAP, and when I have conversations with HR leaders and we're talking about mental health, EAP is always the first thing that is brought up. Let's talk for a moment about the employee assistance programs. Almost all employers have one. Some of those are come free with some kind of ancillary benefit that they may have. Others are standalone that the employer pays for. But let's talk about the EAP. How can an employer best use the EAP for the betterment of their employees?
So first of all, EAP is phenomenal. But I am concerned that many organizations often feel like this is our mental health resource for our staff, and we're done. We've got it, right? We've checked the box. But often, if you look at the utilization of EAP, it's quite low. And so many of the opportunities within EAP are around education and engagement. A lot of individuals don't know what EAP offers and the benefits, nor do they really know the benefits of therapy. And so as a result, they don't often think of EAP as an option. And so to your point, educating leadership, educating staff on the benefits of EAP, how helpful it is, not just to the employee itself, but the family as well. Additionally, engaging employees around EAP. Often there is not a strategy when it comes to communication around EAP. And so going back to the conversation we had about what are your employees stressed about? Once you know those questions, and it's going to vary, but once you have a better idea of what your employees may have that is triggering their stress, then you can actually provide very targeted engagement strategies around EAP. So often individuals will get stressed around major life events and crises, such as the death of a family member, or even a joyous event, the birth of a first child, right? Those things can be very overwhelming. And so, targeting that specific event of knowing, oh, I have an employee that's expecting their first child. During our one-on-one, I'm just going to offer EAP as an option. It's something that an employee is probably not even thinking about. They're dealing with the overwhelm as best they can, but it would be great to talk to someone and share what they're going through and get that support.
Yeah, and I like that emphasis of the frontline managers or the people that are dealing directly with the employees having that background. I think from a corporate standpoint, we also need to do a better job of communication. And if we present the EAP at open enrollment and never, ever mention it again throughout the year, it's not going to have an impact.
Absolutely.
When I talk to employers, I encourage them, you got to find a way to put that EAP out there in front of your employees, in front of your team all year long.
Absolutely.
And to me, when it comes to that communication, I think there's three main things that employers need to communicate. Number one, they need to overemphasize the anonymity of calling into the EAP. That HR is not going to know about that they called. The organization isn't going to know. This is completely private between you and the EAP, and you need to check with your EAP to verify that, but in most cases that's the case. But you want to promote that, because one of the barriers of people calling in, they don't want their employer to know that they're calling, that they have this issue. So you need to overemphasize the fact that it's anonymous when you call in. The second thing, and this is true for almost all EAPs, is that they will offer a number of free sessions, therapy sessions, counseling sessions, and it's not a number like, say, 3, which is most common for some of the, especially the free ones that come with ancillary benefit. It's not just 3 for the year, but it's 3 per issue for that calendar year. So I may have several different issues during the year. For each one of those issues, I can get 3 visits. And it's not just me, but my family members as well. My children, that are on the medical plan, my spouse, they can call in too. I mean, you could have multiple. So you want to communicate. It's anonymous. It's multiple issues, and it's for everyone on the plan. And I think that's just huge for us to be able to communicate, to make that clear to our employees. What you have any ideas, Yinka, on how we can communicate the EAP throughout the year to our employees to keep it in front and center?
Right. So I am a firm believer that mental health and many of the things we talked about today need to be incorporated in some type of a strategic plan. And so it's a consistent touch point that the organization is having with their employees regarding mental health. And so since people, do have fatigue when it comes to surveys, those need to be used sparingly, but other options are focus groups, presentations, having panel interviews. So there's different ways to touch on this topic of mental health, making it interesting and engaging, and EAP can be woven into that. One thing that I have really loved is also humanizing EAP. So introducing some of the counselors or the therapists that they may meet on EAP within these events, even if it's, just having someone share a bit about who they are and why they do what they do can go a long way for people to understand, okay, there's another human being on the other side of these calls, and I feel comfortable talking to them. And so I think there's creative ways organizations can do that. But I would say the first piece is making sure that mental health is a consistent part of your communication plan and that you are consistently providing support and touch points for your employees throughout the year.
Yeah, and I agree. And I think one of the things that we need to communicate regarding the EAP is that it's not just for anxiety and depression or other major issues. I mean, you can get financial well-being, information on elder care, issue on parenting, issues on pets, issues on buying a house, budgeting, all kinds of issues. In fact, I gave a presentation recently to one of our clients on their EAP, and I said the number one topic that this particular EAP has people logging in for is on how to find childcare. I go, that's the number one. If people see those resources and they get familiar with it, well, then when they do need the therapy, when they do need the counseling, they know where to go. One of the things that I've done with a few of our clients is we've created an EAP survey or a scavenger hunt where we go into the EAP and we find various components of it, and then we give like a survey monkey or a survey, and everyone who answers these 4 questions by looking at the EAP will be entered into a drawing for a prize. And what that does is, number one, it helps the employees learn how to log into their EAP, know where it is, where to find it, get the app, whatever it is. And then second, it exposes them to all of those issues and things that are addressed in the EAP, so that they know that when something comes up, that's where they can go. And we found that to be very helpful in communicating the EAP to people. You know, when it comes to the EAP, it's like everything else in business. It's nothing new, and what we're seeing here is nothing new.
Right.
It all comes down to execution. Like you said, are we going to have a strategic plan? Are we going to strategically decide how we will communicate the EAP throughout the year, and where are we going to plug it, and how are we going to plug it? Again, we can't just leave it up to doing it at the open enrollment. Anything else there you want to share about the EAP that you think is important before we move on to another topic?
Right. The only other thing I would add is, just like with any program, it's critically important that there are metrics assigned to EAP. Since this is typically the primary resource or the initial resource that's used to help help employees with mental health concerns, it's important to know, is this helpful for your employees? Are they satisfied with the services that they're getting? Is it meeting the mark? And what is the utilization? And so back to the importance of not just checking the box with EAP as part of that strategic plan, there needs to be metrics that are decided upon and that are monitored consistently throughout the year to then determine the success of the EAP program.
And I agree, and I think that's one of the reasons why some employers need to consider paying for an EAP as opposed to taking the free one. Those that may offer more sessions, those that may do a better job of promoting their services, those that may better engage the employees. So there's something to look at, looking at some of those EAP services that may cost a little bit more, but the impact will be much greater. And I want to add this too, Yinka. The EAP isn't going to be enough. Even if you have 10 sessions, sometimes some issues, some people need more. And that's why we have medical plans. That's why we have medical benefits. And I was working with one of our clients, talking with the HR last week, and we had done a campaign on mental health. And one of the emails that I had prepared for her to cut and paste into their emails and their newsletters was just a listing of all the ways through their benefits they could access mental health care. And that included the EAP. It included how to go through the medical plan, how to go through their telehealth option. They also had an app that they were using. And so we put all of that into one place. And she said her employees came back saying how grateful they were to have that information. So sometimes it's just taking a little bit of time to clarify for the employees. Here's who you go to. Here's the email address. Here's the web page. Here's the app. Here's how you get into this to make it easier for them to know where to go and when to go to to get those professionals. So we have to use the medical plan as well, as in addition to the EAP. I want to change subjects here just for a second.
Okay.
So, at the benefit company, we use a lot of data. We're about data. And data includes claim data. So we can see, whatever's happening, everything's HIPAA compliant, but we can see what's happening with an employer's healthcare spend. And a lot of times when we're looking at this data, we see the mental health issues. And what we often see is that it's not always just the employees, but a lot of times the most significant chunk of the mental health spend is taking place not only with spouses and partners, but with the children of these employees. And research tells us that 50% of all lifelong mental health issues are discovered by the age 14 and 74 by age 24. And so a lot of our employees are dealing with the mental health issues, often quite significant with their children. Now, honestly, we're grateful when we see it on the claims, not because we want them to have issues, but we know that it's being addressed. Because 60% of mental health issues are not being addressed. But there's a lot that's happening with our children, even our young adult children. What would you say to the employer to help them address how to provide the mental health care they need for their children.
Thank you for bringing that up. Yes, that has been such a serious issue that has continued to just have more visibility as we went through the pandemic. And so I think it does get back to the medical plans of ensuring that you have medical plans that support the whole family and allow the parents and the caregivers to get the attention needed for their children and for their young adults. I would also just speak, to the parent and the caregiver to say that it's important that as you are supporting your child through this, that you are also taking care of yourself. What we often see is that parents or caregivers in their desire to help their child and they begin to worry, and they often will neglect their own needs. And then now you have an unhealthy parent who's now trying to take care of a child who's in crisis as well. And so other opportunities can also be support groups. There's also family counseling that can help. It's important for parents to also take care of themselves and make sure that there's open communication with their child, that they're observing their child's daily habits and seeing if there's changes and bringing in the support that's needed. And employers really have a great opportunity there to make sure parents are supported and have what they need to be successful with their family. And I will just add too, I saw a video a few weeks ago, and this was a child that was pictured on one of those nanny cams. And the child woke up in the middle of the night. It looked like it was about 2:00 in the morning, couldn't have been more than 4 years old. And the child began to self-soothe herself. So she started to say, "Oh, it's just a bad dream. I'm okay. I'm going to go back to bed. I've got this." And I realized that her parents had started to teach her healthy coping strategies for when she, would wake up in the middle of the night and have a nightmare. And so I would just share with parents, it's never too early to start talking to your children and helping your children with developing healthy coping strategies to deal with their negative emotions or negative experiences that may happen in life, because we can't control what may happen regarding negative experiences, but we can certainly control our reaction, our perceptions. And so that was so encouraging and also very cute to see her do that. And after she finished a few rounds of that, she went back to bed. And it just was such a beautiful thing to witness, and seeing at just such a young age, she is starting to realize the importance of positive thinking and the importance of self-soothing and self-encouragement.
Somebody taught her that.
Absolutely.
Somebody trained her. So.
And she is
caught it.
doing it. Exactly. So just want to encourage parents that healthy coping strategies are great to start early with children.
Sometimes when I work with employers, we will do a series of campaigns throughout the year. Sometimes they're once a month. They do it on well-being. And it may be financial well-being, it may be heart health, it may be diabetes, it may be breast cancer awareness, it may be activity, all kinds of things, spiritual health, whatever it may be. One of those campaigns could be the mental health of your children, how to support your children. And a great resource that I've come across, and we're going to put this in our show notes when we publish this, but the Child Mind Institute out of New York, even though they are providers for that local area, their resources on that website for dealing with behavioral health for children is just phenomenal. And we'll make that available. But I mean, when employers can push out that kind of information, and just realize the strain that's on their employees, because they're dealing with some heavy stuff at home. When it's your children who are in pain, that employer is in pain.
Absolutely.
And anything that we can do to help them support that, I think is going to be very important.
During the pandemic, I did a focus group for parents for one of the organizations that actually is part of the benefit company. And it was such an incredible experience in recognizing that parents may need additional support beyond what is provided within the organization. So that's definitely, I think, a great call out to look at that group as well for needing potential more support than what they're getting.
Very good. want to change subject one more time.
Sure.
Okay. We talk about culture, and we have a lot of people here that are listening that are in HR, and I'm going to put my HR hat on again. I used to work more in HR, and we have policies and we have procedures that we put in place that really contribute to the overall well-being of our team. And my question to you is here: what policies and procedures do you think are most important? Let me put it this way. There's a quote that is attributed to Desmond Tutu, but the origin of it is unknown. But he says, the quote is something like this: instead of pulling people out of the river, we need to go upstream and find out why they're falling in the first place. So when it comes to mental health, we're trying to pull people out of the river. This is a therapist, this is a psychologist, a psychiatrist, all the clinicians that are there. That's pulling them out of the river. But that preventive is upstream. And that's where we put in all of these various components of social connectedness, of financial well-being, of spiritual health, of community health, all of these things that contribute to that. But also the work environment plays into that. And when it comes to HR, there's things like diversity and inclusion and equity and accessibility, sexual harassment policies. How do those policies contribute to this discussion on mental health?
So absolutely important to have those policies in place and also ensure they are actually being
executed.
Exactly.
Enforced.
Enforced
to use the tough word.
And I would take it a step further in just saying that I do believe many of the DEI discussions around diversity, equity, and inclusion are very critical to mental health. I would say they could even be sister conversations, because when you have an environment where people feel included, where they feel like I'm going to be treated in an equitable manner as well as it's diverse, I feel like no matter who I am, I'm accepted and I can thrive in this type of a culture. And that is an environment that is definitely supportive of everyone's mental health. And I would also add, when it comes to the culture aspect, there is some cultural characteristics that we have within our corporate life that can really be detrimental to mental health. So for instance, when it comes to dealing with burnout and overwhelm, oftentimes there may be a culture of urgency in those organizations where everyone's running around with their hair on fire every single day. And it's overwhelming for employees to feel like they're always behind. They're never where they need to be as far as having their tasks done. And as a result, it leads to this feeling of I'm burnt out and there's no end in sight. And so that's when you can have a really hard time maintaining great employees and issues with retention. And so it's important that there's a normal just give and take with regards to corporate culture where, yes, there are going to be days where it's going to be very busy, but there also have to be slower days where people can take a breath and catch up and be able to connect with their coworkers and just enjoy their work. And then you get back to the busy day. So there needs to be a very much of a pattern or a rhythm of some sort rather than every single day, everything.
And that's got to be intentional,
correct.
Right?
Correct.
And we all know in business, sometimes it's going to be hectic. Correct. And you're going to have seasons where, okay, we have to get this work done.
Absolutely.
This is what we have to do.
Absolutely.
But you're talking about being intentional, about understanding that and doing what you can during those seasons to help your employees through that.
Right, for sure. And agree, there has to be intention from leadership regarding providing that type of rhythm and pace that's actually going to support mental health.
Yinka, one of the reasons I wanted to invite you here is that I wanted to give exposure to you and your services because you can come alongside employers. And we're hoping some of our employers and friends will say, hey, we want to have Yinka come and talk to us. Tell us a little bit about what your services are and what you can offer? Is it just here in Atlanta, or do you travel? Tell us what you can do for an employer.
Absolutely. So I really, as I mentioned in the very beginning, have had this passion to help other leaders and organizations figure this out, because I struggled for so many years with regards to how do I manage my own stress and how do I actually have great mental health at work. And so I really work to equip and empower and educate leaders and organizations for how they can have strong stress management strategies, have an environment that supports strong mental health as well.
What's your format for that? How do you do that?
So I do that through keynote presentations, lunch and learns. I also do workshops that are a bit longer to get into more of the detail regarding how you build those healthy habits. And as needed, I also do consulting for organizations that want to work together to figure out a strategic plan for their organization with regards to how we handle mental health.
Okay, and what is your geographical footprint? Is it just here in Atlanta, or do you travel?
So it's nationwide. Okay. I do travel quite a bit. And so definitely I'm based here in Atlanta and do work here, but can travel.
Okay, that's great. And I hope some folks will take advantage of it. We'll put your contact information in our show notes. And of course, anybody can always contact us if they need to find you. We'll be happy to do that. As we come to a close, leave us with one comment. What's one thing that you would say to our employers that are listening in today? What's the one thing you want to leave us with?
So one thing I would leave with is, as I shared in the beginning, I received the diagnosis of hyperthyroidism, and that was a major wake-up call for me. And through very focused intention of changing my habits at work and personally, my hyperthyroidism has been reversed. And so I want to leave with just sharing that success story and also pointing back to the importance of our daily habits and our strategies. Oftentimes, we don't give much thought to how we think, our perceptions, our beliefs within our daily work and life, but they are so important and they add up and they provide momentum. And so that is really such an opportunity for our employers out there to equip their employees, their leaders with the support and the tools that they need to be successful with regards to how to support their mental health with their daily habits, and that also feeds into their physical health as well.
You know, I'm a big proponent of lifestyle medicine. There's a lot of what we do of our lifestyle that contributes to our physical health. You've just shown and exemplified the same is true for our mental health.
Absolutely.
And those two are closely related. Yinka, this has been great. It's been great having this conversation with you. Grateful for what you are doing for employers across the nation. And thanks so much for spending this time with us.
Thank you. It's been a pleasure.
Great.